Hi dear students, welcome to ardentmds. The topic in front of you is dentofacial orthopedic appliances. So what is an orthopedic appliances? Orthopedic appliances are the one which are used to address the problems with either maxilla or the mandible. So to begin with, the orthopedic appliances can be categorized into following types. That is, we have a headgear, we have a reverse full headgear, or it can also be called as face mask, and one which is meant for mandible is called as chin cup. So in this session, we will see in detail about headgear. So what is headgear? So headgear are the orthopedic appliances which are used to address the prognathic maxilla. So let us assume the class 2 malocclusion. So in case of class 2 malocclusion, we will have increased overjet, right? So this can be either due to prognathic maxilla, or the second etiology would be retrognathic mandible, or it can also be due to combination of prognathic maxilla or retrognathic mandible. But these particular appliances are used to address only the prognathic maxilla. So these headgear appliances which are used to restrict the growth of forwardly displacing maxilla. So in it we have different types of headgears. So any type of headgear will have following components. So we have a force delivering unit, and we have a force generating unit, and we also have an anchor unit. So what is a force delivering unit? So this is one of the component of headgear which delivers the force from force generating unit. Then what is the force generating unit? These are the element of headgear which generates the force in order to restrain the growth of maxilla. Then what is anchor unit? And this anchor unit is the main premise for classification of various types of headgear. So let us see little in detail about anchor unit. So for example, if I want to move or push or pull some object, I need a rest or support on my leg over the ground, right? So that support on the ground is the anchor. Similarly, if I have to restrain the growth of maxilla from moving forward, I need some support over the head. That's why this appliance is called as headgear, because it is taking support from the skull or head region in order to restrain the growth of maxilla. And based upon area of support, the headgears can be classified into following categories such as cervical pull, occipital pull, parietal pull, and combi pull or combination pull. Let us see one by one in detail. So before that, the anchor unit has two main components. It can have either a head strap, this is the head strap, or it can also have a neck strap, right? So then where should we apply the force? So this is the premise of biomechanics of headgear. We also know that if I have to push an object in a straight or in a bodily manner, that is, if I don't want that object to move or rotate, I just want our object to move as straight as possible, I should be applying the force at the center of the object. For example, if I want to push this pen straight manner, I should apply the force in the center of this pen. What happens if I apply the force either at the tip of the pen or here? It will rotate. Similarly, and this rotation is called as moment of the force. So this we have seen in many sessions like biomechanics. So similar concept can be applied here as well. So this is the whole maxilla. So if I want to move this maxilla backward, I just have to apply the force at the center of the maxilla, or to be precise, at the center of resistance of the maxilla. So when I apply the force at the center of resistance of the maxilla, what happens? Without any rotation, maxilla just gets displaced. Okay, so this is the center of resistance of the maxilla. So here comes a question: where is the location of center of resistance of the maxilla? Various authors have given various location, but the most commonly used precise location of center of resistance is posterior superior aspect of zygomatico-maxillary suture. So this is the zygomatico-maxillary suture and posterior and superior region. So this is where the location of center of resistance of the maxilla according to authors Stockley and Tusher. One more author, Dr. William Prophet, had mentioned that the center of resistance of the maxilla is located between the roots of two premolar teeth. So this is also another center of resistance of the maxilla. So depending upon the options we have in the question, we should answer, right? So coming to different types of headgear, and the headgear in this slide is classified based upon the site of anchorage. If the site of anchorage is at the occipital region, it is called as occipital headgear. If it is cervical, that is nape of the neck, it is called cervical pull headgear. If it is in the front portion of the head, that is if it is from the parietal bone, it is called parietal pull. And what is the combination pull? Combination pull have either two of the anchor sites, that is it can have a cervical region plus occipital region. So if it has two source of anchorages, it is called as combi pull or combination pull headgear, right? Now let's go to the first one, the cervical pull headgear, which is given by Clohan. So as the name suggests, here all the headgear are classified based upon the site of anchorage. So as the name suggests, what happens here is the site of anchorage is at the cervical region, that is in the nape of the neck, back side of the neck. So now let us see how this headgear works, what it actually does to the maxillary dentition. So here, since the source of anchorage is below the occlusal plane, first this will extrude the maxillary molar. Why it is extruding? Because the source of anchorage, that is I am standing here, and if I pull something above from my point of location, I will be always pulling down. So similarly, this headgear will always pull down the maxillary molar. Why it is maxillary molar? Because the face bow of the headgear is attached to the headgear tube, which is located on the maxillary molar. So the cervical pull headgear will always pull down the maxillary molar along with distalizing the molar, right? So cervical pull headgear will always extrude the molar and distalizes the maxillary dentition, right? So here we have three different types based upon the direction and point of application of force to the center of resistance of the maxillary molar. So this is little biomechanical aspect. We will again have one more session on biomechanics of headgear separately in detail. Just to look in brief, we know that the location of center of resistance of the maxillary molar is somewhere 1 mm to 2 mm apical to the furcation area. So this is where the location of center of resistance for multi-rooted tooth, right? So if I want to distalize the molar in bodily fashion, I should be applying the force along the center of resistance of the maxillary molar. So when I apply such force, the molar just gets distalized and it just extrudes because the source of anchorage is at the cervical region, right? What happens if I apply the force below the center of resistance at a distance? So what happens, since I apply a force below the center of resistance, I generate a moment. What is the moment? I generate a clockwise moment. So what happens? Molar gets distalized and it extrudes. At the same time, it rotates in clockwise manner. Similarly, what happens if I apply a force above the center of resistance? So here I am applying a force above the center of resistance. What happens? Molar gets distalized because of the traction pull. Molar gets extruded because of the cervical pull. At the same time, molar tends to rotate in counterclockwise manner. So here I generate counterclockwise moment. How do I vary the point of application of the force? I can vary the point of application of the force by adjusting the external bow or outer bow of face bow, right? So now coming to occipital pull headgear. Again, as the name suggests, it is self-explanatory. Since I get an anchorage from occipital region of the skull, this is called occipital pull headgear. So same thing applies again here as well. If I apply a force through the center of resistance of the molar, first what happens? All the headgear will restrain the growth of maxilla and it distalizes. So all the headgear has distalizing component of the force, and all the headgears will either have intrusive component or extrusive component of the molar based upon the source of anchorage. In previous slide, our source of anchorage was in the nape of the neck. So we got extrusion of the molar. But here the source of anchorage is above the occlusal plane. So we will have a mild intrusive component over the molar. So here, if I apply a force through the center of resistance, what happens? My molar gets distalized. Distalizing is common to all the headgear because we are just restraining the growth of maxilla, or we are even actively distalizing the maxilla as well. So here we will be having a distalizing effect of maxilla, and we will be having mild intrusive effect on the maxillary dentation as well. And I won't be having any rotational tendency if I apply a force at the center of resistance. Okay, coming to second scenario, invariably I'll be having distalizing force, I'll be having intrusive force because the site of anchorage is above the occlusal plane. And what happens if I apply a force below the center of resistance? I'll be generating a clockwise moment. Similarly, in last scenario, I'll be generating a counterclockwise moment because I am applying the force above the center of resistance of the molar, right? So coming to another type of headgear, this is called as vertical pull headgear because here I am taking an anchor support mainly from frontal region or parietal bone. So this is also called as parietal pull. Parietal pull headgear, and this is also called as vertical pull, or it is also known as high pull headgear. Why this is called as high pull headgear? Because here there is so much of intrusive component given on the maxilla because the source of anchor is somewhere just above the occlusal plane. So here the more amount of intrusive force is applied on the maxilla from higher region. That's why it is also called as high pull headgear. And since the source of anchorage or site of anchorage in the parietal bone, this is also called as parietal pull headgear, right? So what happens here? Here distalizing will happen, but more of intrusion of whole maxilla takes place. So with this kind of headgear, more amount of intrusive force can be applied over the maxilla. So such vertical pull or high pull headgear can be used to treat the gummy smile patients or the patients who are having vertical maxillary excess. So this is the application of vertical pull headgear, right? We have last variety called combi pull or combination pull. So combination pull headgear always has a combination of two sides of anchorage. So here we will be having one occipital anchorage or parietal bone anchorage, site of anchorage, and one more is cervical region. Okay, what this headgear does to the patient? It does not, it neither intrudes nor extrudes the maxillary dentition. Rather, it just plainly displays the maxillary dentition in posterior region. Okay, so this kind of headgear, it plainly displays the maxillary dentition posteriorly. So again, this can be of three types based upon the point of application of the force with respect to the center of resistance of the molar. So if I apply the force through the center of resistance, I will be having plain distalizing force. If I apply at a distance below the center of resistance, I will be having plain distalizing plus a clockwise moment in the molar. And if I apply the force above the center of resistance, I will be having plain distalization plus counterclockwise rotation of the molar. So this is the application of combination pull. So based upon the malocclusion that the patient exhibiting to begin with, the type of headgear has to be chosen. For example, if the patient is presenting a much of gummy smile or gum display on smile, it is nothing but the maxilla has grown so much in downward manner. So such patients are called as vertical maxillary excess patients. For such patients, we have to restrain the maxilla from growing down. So we should be selecting headgear which restrains the maxilla from growing down. So we should be intruding the maxilla. For such cases, we should be using high pull headgear. Right. There are some scenarios where patient will be having very short face and deep bite. So those individuals are called as short face syndrome patients. That is, their lower anterior facial height would be very less. So for such cases, we should be increasing the lower anterior facial height. So how do we do that? So we have a variety called cervical pull headgear. So when we put on the patient, that will extrude the molar. So what happens when we extrude the molar? The molar gets wedged between the maxillary and mandibular dentition, and when that happens, the mandible rotates in clockwise direction. It rotates downward and backward manner. So when that happens, the lower anterior facial height increases. So based upon the type of facial trait the patient exhibits to begin with, the headgear has to be chosen. Right. Now let us see some review questions based upon headgear. So a major disadvantage of treatment using cervical pull headgear is what? So we know that the cervical pull headgear has the anchor site below the occlusal plane at the nape of the neck. So it always extrudes the molar. So this extrusion of molar may or may not be favorable for patients. So for example, if the patient having open bite to begin with, so what happens in such patients? When we put cervical pull headgear, it further extrudes the molar. So when the molar is getting extruded, it gets wedged between the maxillary and mandibular dentition, and it will open the plane furthermore. So in such cases, the open bite will get worsened. So extrusion of molar is a major disadvantage for cervical pull headgear. So moving on to the next question, very important question. It is numerical based question. The force required to restrain the maxilla by headgear are in the range of, direct question, that is 250 to 500 grams per side. Okay, this is not on total, this is per side. So per side only 250 to 500 grams should be applied. In total, just double the amount, 500 to 1 kg of force can be applied. So we have to look the options very carefully whether they have asked in total or per side. So it is always 250 to 500 grams of force per side of the face. Coming to next direct question, the center of resistance of the maxilla is located at, we know that this is always posterior superior aspect of zygomaticommaxillary suture. So here they should have mentioned the posterior superior aspect. It can never be on antero superior or antero inferior. And this is also a kind of right option, but they should have given between the roots. So please pay attention in looking up the options. So if they are giving between the roots, mostly they will give either one of this, not that both. Okay. So look the options carefully and go for the right one. So one clinical scenario here, the vertical maxillary excess in a growing child can be controlled by, so here a child is having a maxilla which keeps growing forwardly down. So in such cases, the child will be having severe gummy smile or more amount of gingival exposure during rest as well. So for such patients, we should restrain the growth of maxilla from growing downwards. So we should be having something called high pull headgear, which takes support from parietal bone and just holds the maxilla from growing down. So we should be using high pull headgear for such patients. Orthopedic appliance of choice for correcting vertical facial height deficiency. So just let's go back to previous question. Here we are having vertical maxillary excess, but in this question we are having vertical height deficiency. So as we discussed before, we should be improving the height in such patients. So what happens? We should make the mandible. Again, maxilla is a static bone, whereas mandible is dynamic. It keeps growing. It can rotate forward and backward. So in order to increase the height, we should make the mandible to rotate downward and forward. For that, we should be extruding the molar, that is maxillary molar. So when that happens, it gets wedged between the maxilla and mandible, and it makes the mandible to rotate downward and backward. So we should be choosing a headgear which will extrude the molar. So in this option, we have a cervical pull headgear which takes support from the nape of the neck and it always extrudes the molar. So in order to improve the height, in order to improve the facial height, we should be using cervical pull headgear to improve the vertical facial height deficiency. Right. One biomechanical aspect, that is, if the outer bow of cervical headgear passes below the center of resistance of the maxilla and above the center of resistance of the maxillary dentition, what will happen? So we know that if I apply a force at the center of resonance of the maxilla, what happens? Maxilla just gets displaced in a bodily manner. If I apply the force below that, it gets rotated, tends to rotate in clockwise manner, or we will be generating the clockwise movement of the maxilla, right? So here we have two scenarios. First, if the outer bow of cervical pull headgear passes below the center of resistance of maxilla. So if I apply a force below the center of resistance, what happens? I will be creating a clockwise movement of the maxilla. So we should be having a clockwise rotation of the maxilla, right? And one more thing we have, that is the same face bow is above the center of resonance of maxillary dentition. So if I apply a force above the center of resonance, I will be generating the counterclockwise rotation. So let us discuss with the help of picture here. Here, when I apply a force below the center of resistance, what it happens is I will be creating a clockwise rotation. At the same time, if I apply a force above the center of resistance, I will be creating a counterclockwise moment. So to answer the question, there will always be a clockwise rotation of the maxilla, and when I apply the force above the center of resonance of maxillary dentition, I will be creating an anti-clockwise rotation or counterclockwise rotation of maxillary dentition. So this is the right option. So I hope this session was very useful. So we discussed about the headgears, the type of headgears, the components of headgears, and a brief in brief about biomechanical aspects of headgear as well. So in next session we will see about remaining orthopedic appliances that is left. Thank you.